Hi, I'm Dr. Michael Nusbaum.
I'm Dr. Daria Klachko Totten.
And welcome to HealthTalks.
HealthTalks.
All right, so today we're talking about
Perimenopause.
Yeah, that's not a fun time for women. So, I see a lot of patients who are gaining weight because they're perimenopausal, but they're having hot flashes and other things.
Yes, and I see a lot of women that are having a really hard time with it. And it's a time in a woman's life that can be really challenging and really difficult. And a lot of times, women are left asking, like, what's happening to my body? Why am I feeling the way I'm feeling? And perimenopause can be so distressing to some women. And I feel like it's a really important topic for us to go over.
Terrific. So tell us, what's going on and when does it occur and what's exactly happening?
So generally, we start to go through the menopausal transition, which is also called perimenopause. It can be years before we actually stop having our period. So menopause is actually the time where we stop having a period for a year. That signals menopause. The years before are the menopausal transition, and this is when we're usually most symptomatic. And the symptoms are related to the fluctuations in hormones. So what happens in normal times, when we're in our reproductive years, our body has a very complex system that controls the hormones, and it starts in the brain through the pituitary. And the pituitary gland secretes hormones, many hormones, but the ones that we'll talk about today are FSH and LH, so follicle stimulating hormone and luteinizing hormone. These are hormones that are secreted through the brain to push the ovaries to produce estrogen and progesterone. There's a very complex, we don't have to get into it really in depth because it's really complex, but there's a complex system between the ovaries and the brain where there's a negative and positive feedback loop to keep these hormones secreted in a very uniform fashion. So what our bodies do is we start to build a lining for a pregnancy, ovulate midway through, and then stabilize that lining. And when our body starts to realize that we're not pregnant, we get a period and it all cleans out and the system starts again.
Right.
So as we age, our ovaries start to get a little tired. And they stop secreting in such a strong fashion, in a regulated fashion, so that our hormones start to get a little off balance.
Okay.
And that's what we see through the menopausal transition. So some months our hormones might look completely normal, but some months our hormones look really off.
So I was going to ask you about that. So can you go by just estrogen levels? Because I know that there's a specific range, like under 50 something is considered postmenopausal. How does that correlate with the patient seeing their periods and actually going into menopause?
So that's a very, very good question. During the menopausal transition, our hormones are on a roller coaster. So some days, if you might, check a woman's hormones, they might look like they're in the reproductive years. On the next day, it might be a different story. So it's very hard when you're measuring hormone levels in a woman that's through the transition to really be able to interpret those results.
Okay.
Once we're menopausal, it's a lot easier because now our ovaries are exhausted, like they're done. So we're going to see very low estrogen levels, and we're going to see very high FSH levels and LH levels because the pituitary gland is still secreting.
Trying to wake up
hormones.
those ovaries and start making some of those hormones.
And the ovaries are like, I'm done. So they're like not producing hormones in high secretion. So that's a much more predictable level of hormone. But during the transition, it's very hard to assess.
Gotcha.
And it also depends on where you are in your cycle when you're still cycling of where you're measuring those hormones.
Right.
So typically we like to do it in the beginning of the periods because that's a little bit easier to interpret the numbers.
Sure. So two big questions always pop up in this period of time, perimenopausal. One, why am I gaining weight during that period of time? And two, what can I do about the hot flashes and the weight gain?
And that's why a lot of people see me to help answer those questions. So what can we do about the weight gain? So, there's a lot going on in midlife, and, certainly, the stresses of life having to, sometimes be that sandwich generation,
Right,
take
right.
care of, older parents. Then you still, might have children that you're still watching over, and we kind of lose time with ourselves. So one part is to, at this time in life, to say, like, let me regain my health. And it's a great time to look at health milestones. So during this transition is the time to focus back on ourselves.
Okay.
Make sure that we are maintaining a healthy diet, exercising, sleeping well, because sleep is a huge issue.
Sure, absolutely.
And there's a snowball effect that happens with perimenopause. So we start to have hot flashes.
Yeah.
The hot flashes then lead us not to sleep well.
Yeah.
And when we don't sleep well, we start to gain weight. And then it leads to more stress. So it kind of snowballs on itself. So you gotta piece this apart and try to look at all these things that are happening around that time and work on each one.
So what can you do for a patient who is suffering from the symptoms of perimenopause?
Well, we can certainly look at all the symptoms and see what's happening to this person, and look at everybody as an individual. So let's say somebody's suffering from hot flashes, weight gain, brain fog. We might talk about all different remedies. So there are natural remedies that we can look into.
Sure.
If you walk into a pharmacy, you can see a whole section on natural
Do those work?
phytoestrogen. Well, if you look at the studies, no.
Okay.
So when we look at those phytoestrogens, so those are substances that are natural, but they mimic estrogen. And really, we don't know how much of this estrogen effect are in them.
Right.
So it's kind of there's probably very, very little. So it's probably not harmful, but we don't know. So you have to use those with caution. I've definitely had some patients that say, "Oh my God, this really helped me," but the majority, the studies don't seem to support their use. And any kind of herbal medicine or over-the-counter, you should always check with your doctor
100%.
before starting that.
Absolutely.
There's also other medications that are prescription that are used off-label to help with hot flashes.
Okay.
There's some medications that help reduce bladder spasms that can help as a little benefit of that med is that it can help with hot flashes. Certain anti-seizure medications can also help. So those are off-label uses that seem to help a majority
But
of
it's
people.
really important to go to your gynecologist, find out what's
100%.
going on with you, let
Yes.
them help you. Don't just jump onto something. Even
Oh,
with the
for
herbals,
certain.
you really
Yeah.
need to get that professional help.
Always, because everybody is different, and the way your body responds and your certain set of circumstances, you want to make sure you're doing the best thing for your body.
Absolutely.
There are medications that are now FDA approved for hot flashes,
what are
which
some
is
of those?
great. So there's antidepressants, certain antidepressants on very low dose, so not a antidepressant dose, but
Okay.
on low dose can really help with hot flashes.
Okay.
As well as a new medication now that's NK3 that just kind of over recent times have been started to use, which works at the level of the brain. So this is a non-hormonal option that seems to really help with hot flashes. And then of course we have the gold standard, which is hormone replacement therapy.
Terrific. Well, I hope this helped. Thank you for joining us. I'm Dr. Michael Nusbaum.
Dr. Daria, Totten.
And thanks for joining us at Health
Health
Talks.
Talks.